Good afternoon. Welcome to our 4 o'clock press conference. My name is Dr. Eric Gzodzinski. As you will see, we're trying to make sure that the community is as well informed as possible. Yesterday we had hospital leaders come talk to the community. Today we're going to have fire chiefs and talk to the community about what they are doing and how we're being prepared. So we are trying to make sure that you're getting as much information as you possibly can to make sure that you can make informed decisions. I'd like to start off with numbers that we have today. We have 13 confirmed cases, 4 are women, 9 are men. This is the hard part of the job right now, ladies and gentlemen. I need to report our second death in Lucas County. I was trying to figure out what to say to you today, and I really think that I just want to say you need to please adhere to what we've been telling you. Stay at home. Only go out when you actually have to. Wash your hands. If you're sick, make sure you're staying at home, even if you're an essential employee. I really do not like to report these, and I'm hoping that we don't have many more to report. We know we will have some, but it is up to this community to make sure that we do not report these in excessive numbers. So please, please, please adhere to what we've been asking you. The age ranges for our cases are 29 to 76. A little bit of a correction yesterday. Again, we're trying to make sure that we do this the right way, and we have a new age range from 29 to 76, a little bit different than yesterday. We'll continue to provide these to you. Want to give a testing update. I know that the media and everybody is trying to work hard to get numbers, and so are we, and they are important from those testing numbers we've had in the community. The COVID tests are performed at the area hospitals, I want you to know, and other health facilities, and they're the ones who get the test results, and so there is a system in place to do that, so it just doesn't come to the health department. There is that system where those tests are given to the healthcare facilities. And let me tell you, they are working on finding a way to streamline this. Again, this is all new to everybody. Lag time of tests and things of that nature, that is a true concern. We've not experienced this. But they are trying to streamline that data to get it to all of us, including local public health. The lag does happen because of the test kits. As we know, they're in short supply. But more importantly, it's how it's processed. Again, as we overload those laboratories, we have an issue with actually getting a quick response to those lab results. Actually, some are taking up to 10 days. So again, bear with us. We're trying to streamline that process, and I'm hoping that this next portion of good news will help everybody kind of take a breath and say, okay, we're on the right track. The good news is UTMC has become the first laboratory in Northwest Ohio with the capability to test for COVID-19. Outstanding news. This means they will get results back in a more timely manner. In fact, again, please don't hold anybody to this, but we are looking at 48-hour turnaround time, which is much better than that 10-day, which would be tremendous help and relief to the people being tested. Again, you're there sitting wondering if you have COVID-19 and waiting 10 days, that is extremely difficult. Just to be clear, the general public cannot just go to UTMC for a test. That is only a laboratory component of this entire process. You still need to follow the process of going to your physicians or to the hospital to get that test done. The test then will be shipped to UTMC to actually have run. The Health Department and Emergency Operations Center are constantly planning for emergency scenarios like what we're experiencing with COVID-19. We put strategies and processes in place for what we think will be the need and what will happen. But the reality of a crisis like COVID-19 presents us with challenges that we've had to adapt to, and that is the case when it comes to our frontline EMS workers. As you know, Springtail Township had an incident, and although what I told was accurate, we followed the plan we had in place. Communication is the first thing that breaks down in any disaster event, and let's face it, this pandemic, we've never experienced something like this disaster. The communication breakdown in the middle of everyone in the system trying to do their best in this terrible situation. I want to assure you all we had been working very hard on updating the process and plan. I'd like to bring up the Springfield Fire Chief, Barry Kuzno, to talk about that very subject. Chief?
Thank you, Eric. As Eric had mentioned, my name is Barry Kuzno. I'm the Springfield Township Fire Department Fire Chief. First and foremost, I'd like to give a shout out to the first responders and the healthcare professionals out there doing their job day in and day out. They are truly the heroes, and they're out on the front lines providing the service during this pandemic. We are navigating through uncharted waters during this challenging time, and I can promise you that all of the fire chiefs, the health department, the EOC, all the responders, we're educating ourselves and implementing appropriate strategies as necessary. I want to talk to you a little bit about the communication process. As you're aware, we were one of the first departments that ran on an incident in Lucas County, and there was a breakdown in communication, but I can guarantee as of the next morning, that communication seemed to have been fixed. The very next morning, I received a phone call from one of the local hospitals, and we continue to get that communication from the hospitals providing us with that information. So that has drastically improved. Also, the EOC, or the Emergency Operations Center that's been established here in Lucas County, they've designated a health wellness officer. That health wellness officer in the EOC works with the local hospitals and the local responders, providing them with the appropriate information, whether they need to be isolated or whether they need to be quarantined. And there's a discussion as well about any possible testing that those individuals would need to go through. Currently, Lucas County, we have 24 first responders in quarantine and 3 in isolation. So that's a total of 27 here in Lucas County. Please allow me to explain the difference between quarantine and isolations. Quarantine is those who may have been exposed but are not currently experiencing any symptoms. Isolation is a designation for those who have been exposed and are experiencing symptoms. As I said, local fire departments are constantly preparing and anticipating how we might deal in needed situations. We've been preparing for these situations, and we continue to prepare for any type of situations in the future. This is a little new to us, but we do continue to prepare for things that may not necessarily be expected. I would like to thank UTMC for becoming a designated COVID-19 laboratory. Getting those test results turned around quickly will help us get our personnel back on the front line faster for the community and able to put them back in service for our response. So at this time, I'd like to introduce Chief Brian Bird from the City of Toledo.
Good afternoon. I'm Brian Bird, Fire Chief for the City of Toledo. And we as fire departments in Lucas County want to assure all of the communities within the county that we are currently responding to emergencies in the same capacity that we were prior to this COVID crisis. As fire chiefs across the county, we've been working collaboratively, I messed that word up, for a long time and for many years, and we will continue to do that. And we promise you that we will be meeting the needs of the citizens to the best of our abilities, even during these unprecedented times and these things that, as Chief Kuzno said, we've never experienced before. This is such a dynamic and fluid situation that it's a challenge for us, and we are doing everything that we can to work together within our departments and within the county and the hospital systems to address the issue. Thanks to the forethought and planning by several previous fire administrations, we're currently able to still provide personal protective equipment to our personnel when they're responding to these types of incidents. However, despite our best efforts, and no matter what we do, we are unfortunately exposed to viruses and things that can affect us. And depending on the type of exposure, it may or may not require some form of quarantine or isolation, as Chief Kuzno was saying. But again, even though we're experiencing those things, we're doing what we can to work with each other and with the county and the other agencies to make sure that our service doesn't get compromised. Now with some good news. We're going to give some response info here. Compared to February and the early half of March, our incident numbers are actually trending downward. That's ironic when you think about what's going on. Our incident numbers are actually trending downward. And whether it's coincidence or not, this appears to correlate with the requests and orders that come out of the state and locally for our people to stay at home and only come out when absolutely necessary. We don't know if it's a coincidence, but there's a correlation. With that, though, we have seen an uptick in the increase of non-emergent calls to our police non-emergency number. And most of those calls are requests for information. So what that says is the information is getting out there about what our people need to do, but they're still looking for clarification. So with that being the case, we want people to still call our dispatch office when they have issues, but we should not be the primary call for information when it comes to the COVID crisis. I'm going to provide a couple of telephone numbers here that are the numbers that should be called for health-related issues when it comes to questions in Lucas County about COVID. Those numbers are as follows. 419-251-4000. That's 419-251-4000 or 419-291-5355. Again, 419-291-5355. Where our dispatch office can answer questions, we don't have the detailed information that the health professionals have, so that is a preferred call to the health department. We also want the public to know about some changes they may be seeing within our EMS services when our people are out there responding, and to address some of those changes and what people may see is Sylvania Fire Chief Mike Ram.
Thank you, Chief. I'd like to start out by thanking all the workers in the EOC and Eric from Lucas County. The help that he's given each one of us fire chiefs in the area has been impeccable. We couldn't do it without it. I'm Chief Mike Ram from the Sylvania Township Fire Department. I'm going to speak a little bit about our EMS workers themselves. As we know, they are the frontline people. If we don't take care of the frontline people, there's not going to be anyone there to take care of us. So we're really doing everything we can to take care of our EMS workers to the best of their ability. We're making sure that they are eating, that they're getting some rest, and obviously washing their hands and deconning after every incident. What you may see is you might see things done a little differently than what we used to do on typical incidents. You wouldn't maybe see someone in gowns and masks and goggles and everything, but with this COVID-19 we can't take any chances. So what you're seeing next to me is proper PPE or personal protective equipment. On each run, guys and gals are now using every bit of it that we can use. I know it was spoken a little earlier that we're running low on some things. The Emergency Operations Center has people working constantly trying to find, to make sure we're not going to run out of some things, because some of the stuff is disposable, like the mask. Some of the masks are in low supply, so we're working to do the best we can get to that. You can see what they look like right here, 3 different levels. What we want to do is we don't want people to be alarmed. You normally wouldn't see us coming to your front porch. We're in this complete total protective equipment, but now you're going to see this on every EMS incident. What you also may see is you may not see all 5, 6, 7 guys or gals come running into the house. We've changed our procedures a little bit where maybe one person comes in, does the 6-foot distance, does an assessment, and then they turn to the rest of them and say, this is the equipment and this is how many people we need. So it's just a measure to keep our frontline employees as best protected as we can. These are APRs, air purifying respirators. We do have these. The county had these back from when 911 happened. We still have them, but we're having some trouble getting some of the canisters. But again, the EOC is definitely working on that for us. We are here for you. We're dedicated to serving you during this epidemic like we are every day of the year. And there are some things we're asking our citizens to do and help us with. Now I'd like to introduce White House Fire Chief Josh Hartberger, and he's going to give us some of those suggestions.
Thank you, Chief Ram. You've heard my colleagues today speak on the status of your first responders and what we're doing. As you can imagine, we're faced with a difficult situation some of us have never seen before. Most of our departments have a small workforce, which could be adversely affected by COVID-19 exposures and potential illnesses. With this in mind, we continue to respond to true emergent incidents, but also need to keep our first responders healthy so they can continue to serve you. I also want to reassure the residents of Lucas County that your fire departments operate under mutual aid agreements in the event that one department needs additional resources to mitigate emergency situations. We need your help. Please use our 911 system responsibly. While this pandemic continues, there are still other residents who suffer from heart attacks and other serious emergencies not COVID-19 related. Follow the recommendations from your healthcare professionals. Take care of yourselves, wash your hands, and practice the recommended distancing. Please heed the direction of Governor DeWine and Dr. Amy Acton. Stay home unless it falls underneath the defined criteria. Following these steps will ensure that your fire departments stay healthy, strong through this situation as we continue to serve you, the public, to our best ability. And finally, the phone numbers that you'll see here and that you should call for any COVID-19 health-related questions in Lucas County are these numbers: 419-251-4000 or 419-291-5355. Those numbers have health professionals to answer any questions that you may have. With that, now we will take some questions from the media.
About the second death.
Yes.
What details can you provide about that? Where it happened, when you guys were notified, names?
Sure. Yeah. At this point in time, I was just actually notified a little bit before we came on camera today. The question was about the second death. I was just notified here recently, actually I think within the last hour or so, that that individual did pass. I don't know when that individual actually did pass. I'll try to get you some more information for tomorrow. Is that all right? Thank you.
And any suspected deaths from the virus that haven't been confirmed?
No, that would be a little difficult too, relative to suspected deaths. Again, the issue that we have is that we have the positives and how those people progress through the disease state, and then unfortunately we actually present the death from that positive case. So it's a little hard to see, you know, is there somebody suspect for a death?
Channel 24 is asking, what can you tell them about the quarantine at Vistula Manor on Cherry Street?
The question was the alleged quarantine of Vistula and Cherry Street. I have not issued any quarantine orders in Lucas County for any buildings. That was I think a miscommunication on the manager's part relative to what we needed to have done is go ahead and make sure that they're obeying social distancing, hand washing, and things of that nature.
Channel 13 is asking about an update on the conditions of the patients hospitalized.
What are the conditions of the patient's hospital? I do not know. I do not know.
How many patients are hospitalized?
That I don't know either at this point in time. Again, don't forget those tests are pending and things of that nature, and I just don't have those numbers. That I don't know that either. Let me see if we can't get you that as well. Okay.
There's a question
I don't have any specific examples, but I'm sure that some of them have. A lot of our firefighters have expressed concern, obviously, about this issue and the things that they are experiencing and knowing that they are being possibly exposed. So we do have some of our members that have, upon their own accord, actually, they're not staying with their families. So the answer to that question is yes, but I don't have a lot of detail on how many or who.
Sure.
So basically, you guys have a press conference every day, 4 o'clock, you come here and you guys give us updates and we ask some questions. Why don't you know when this second death occurred? Why don't you know how many confirmed cases were in the hospital? Why don't you know these kinds of basic things that people are all wondering?
The question was, you know, we come to the press conference and we try to present the most accurate information we can. You asked me about the death, and like I said, the death just happened this afternoon, as far as I know. The numbers that you asked me about, the hospitals, hospitalizations, again, I don't want to make an inaccurate statement. I think it's probably about 7, but I don't want to make a statement that's not true. Again, we're trying to be transparent, but again, I don't want to give information to the community that isn't right. You know, the numbers of tests we're trying to get, and I'm hoping that, you know, we can do that. Looks like there's a system in place that we're going to be able to do that. But you got to remember, there's a lot of different pathways to get that data from those hospitals. So. Anything else? All right, thank you.